Hello everyone, we were talking about ADM classification in our last video. So now in this particular video we'll move on to understand the diagnosis, treatment and prevention. So of course it's something really very lengthy and very cheesy kind of classification, but then of course as per the previous question papers, you need not worry. This is something which is least asked, at times not at all asked. But then make sure you understand, you go through the notes and learn. So diagnosis, talking about diagnosis, the fluorescent angiography allows for the identification and localization of abnormal vascular process. So fluorescent angiography is a technique to diagnose it, in which optical coherence topography is now used. Now it is the optical topography which is mostly used by the ophthalmologist in diagnosing and follow-up evaluation for the treatment of AMD. So what they do is using either Avastin, which are injected into the vitreous of your eyes at various intervals. So they try to find out the lump formation or the deposits of the yellow color on the mucular part of your eye, but then this is done by these means. So of course it's really tough to grab these things. So but then I'll just put across this to you. Do go through, but you need not worry in terms of your exams point of view. But do remember the full form of AMD. So moving on to treatment, of course diagnosis is really very small and it's complicated. Moving on to treatment, most of the treatments that are available now and are currently being studied are aimed at stopping neovascular, that is the wet form of AMD. We spoke about that. So we do not have a medication or any treatment for the dry form of AMD. So we only have for the wet form of AMD, neovascular AMD. So there is an incident shared in the document which I'll be providing you. So in that, in June 2006, the drug Lecatinus has been approved by FDA for use in the treatment of AMD, and it is also called as ranibizumab. Lecatinus is also called as ranibizumab. It has been shown that to halt the progression of the disease. This will prevent the progression of disease. It will not cure the disease by root. It will only prevent the progression of disease in most of the patients who are receiving the treatment. It's just something like whatever we are providing the medication of malaria right now in terms of corona days. So those medications will help you boost the immune system, and that will prevent the virus to get deposited in your cells. But then this is not the cure for corona. It's something like that. So this medication will stop the decaying of the increase of problem in your eye, but then that doesn't cure the disease. It will prevent the growth of the lumps, the yellow color lumps that is grown in your eyes. That is gonna prevent. It will not cure the disease for sure. Unlike previous treatments, which was significant majority of 70% receiving ranibizumab had an improvement in vision for at least one letter. So make a note of it when you say that 70% of receiving ranibizumab, that is Lucentis, the same medication, earlier when it was given, it would improve your vision by at least one letter. And up to 40% of patients had significant vision increase of 3 lines or more. So this was only in 40% of patients, not more than that. And in addition, up to 50% had a vision of 20/40 or better after 12 months of treatment. This is significant as This medication was the first therapy to show statistical significant improvement in people reported outcomes. So no other treatment than this showed any form of improvement. This was the only treatment which showed certain amount of improvement. Though it is after 12 months, it is not all of a sudden, though it is after 12 months, it was appreciated then. So the prevention is quite better. So age-related eye disease study showed that the combination of high dose of beta-carotene, vitamin C, vitamin E and zinc can reduce the risk of developing advanced AMD by about 25% in those patients who have earlier but significant form of the disease. So when we said AMD, age-related so you lose your vision based on your age. It is mostly seen when you are 50 plus and 60 plus, and even we have mentioned that this is seen in the younger people, but then this is not as worst as in the elderly population. When we say that this disease could be prevented 25% in those patients who have earlier signs of this, those during their young ages, if at all they came across this kind of problem, then this could be reduced by 25% in them by intake of vitamin C, vitamin E and zinc, as well as beta-carotene. So this is the only proven intervention to decrease the risk of advanced AMD at this time. Only proven intervention. So you can prevent the AMD problem only with this means, nothing else. And follow-up study related to the age-related eye disease is also required. And you have many more benefits of fish oil. And however, this is the potential benefit of fish oil is recommended when the studies are going on. Despite the reported benefits, there is a considerable debate about the formulation and use of these supplements. So you can't, it's something like when somebody told you that you can avoid corona by drinking hot water and drinking you have many things like drinking hot water with tulsi. You can drink you can crush pepper into milk and have it regularly or one time at a day, or just have turmeric milk. This will all prevent the coronavirus, but then this all will help you to increase your immune system rather than preventing coronavirus. And same way, these things are potential signs for you to improve your eyesight, but rather than this will not prevent your damage to the eye. So this is how it is put across. So this ends with this. Your syllabus has come to an end. So you will have a statistics portion which I have already uploaded. So I'll be sending the copy of that, and you go through the statistical part after you finish the theory. So this ends your syllabus. Hope you all have understood, you all have a clear understanding of what it is. Of course, AMD classification is little, it's really a little messy thing. It requires you to read the document, listen, then read again, remember names of the chemicals and the various medications. But then these things are not really required to that extent, but then you have to know this. So it is least asked, but do study this. If at all you have any doubt, you can get back to me anytime, and hope this was fruitful to you. Thank you.